Hello, friends out there. We want to talk about causes of miscarriage. And there are several reasons miscarriage may happen. And although most of the times the cause is often not identified, can happen in the first, the second, or the third trimester. And of course, if a miscarriage happens during the first trimester of pregnancy, that's the first 12 weeks or the first 3 months, it is assumed that it's usually caused by problem with the unborn baby, the fetus itself. You understand? So it's the problem of the fetus, and about three in every four miscarriages happen during this particular period. And when it does, it's not palatable because as a woman, you are pregnant and you have started bonding with this baby right from the first day. And 12 weeks, few weeks down the lane, it is not usually palatable. And if a miscarriage happens after the first trimester, that is the second from the 13th week up, it may be the result of things like an underlying health condition, especially the mother's health problem this time around. You understand? And of course, these late miscarriages, apart from the mother's milk, they might also be caused by an infection, maybe around the baby itself, which can lead to the back of the bag of water that is covering the baby to break before any pain or any bleeding. You understand? And I want you to know sometimes they can also be caused by something we call the neck of the womb. You know, the womb has a neck which opens up. That's the cervix. When it opens too soon, the bleeding starts. You understand? So we have various causes. So we'll be discussing in this video the first trimester miscarriages. What are the causes? The second trimester. The first trimester, for example, are often caused by a problem with the chromosomes. There's something we call chromosomes. That's when the baby takes, women have 23, the father has 23, then there will be division and all that before the baby can take part of my own DNA and the father's DNA. So chromosomal problems are a block of DNA. And when it happens, it contains a detailed set of instruction that control a wide range of factors, not just something from how the baby, how the cells of the body of the baby develops, to what color of the hair the baby we have. You understand? The chromosome is so important, and you can't just wish it away. So sometimes something can go wrong at a particular point of conception. And when it happens, what happens? And the fetus just receive too many or negative instruction. You understand? Or not enough chromosome, or the division. Maybe there is problem with the cell division in the first trimester. The reasons are just often unclear, that we might not be able to say this is the reason. But it means the fetus will not be able to develop normally, because if there is a problem with the chromosome, it's a very serious one that the baby might not get to term. And of course, this one, if there is a chromosomal problem, it might result in a miscarriage. You understand? And of course, at times, if it is like that, this is very unlikely to recur. But it does not mean that there is any problem with you or your partner. No, it does not necessarily mean that it's because of my partner or it's because of me. No. Then, of course, another cause, apart from chromosomal abnormality, is ectopic gestation. This potentially is very serious, but rare type of pregnancy, which occurs when the fetus begin to grow in the fallopian tube. This is the womb, for example. This is the fallopian tube. This is the ovary. Then the fetus begin to develop outside the womb. It's not staying in the womb, it's just staying outside. So When it happens, ectopic pregnancies cannot be saved. And of course, they are a medical emergency requiring immediate care. Might be surgery, might be treatment. We have various technology that they use now. So, number 3, it might be placenta problem. Placenta is the lifeline for this baby. It's the organ that feeds the baby, linking your blood supply to the baby, linking your oxygen, your nutrient supply to the baby. And if this placenta that serves as a barrier and a life supply, a nutrient supply to the baby, if there is a problem with the development of the placenta, of course, it can lead to a miscarriage. If there's a problem with placenta, because the placenta is the lifeline, it's just the only connection. That's when we have cases like abruptio placenta, it's not very easy. When the placenta suddenly detaches from where it is and supplying the women. And of course, it might happen and in women over 45, more than 5 in 10 pregnancies will end in miscarriage. You understand? That is why it is advisable, if it is possible, when you are 45 above, you can try other like surrogacy, like IVF, like other things. A pregnancy may also be more likely to end in miscarriage if you are obese. You understand? Maybe you have severe obesity. Maybe you smoke, you use drugs. You drink a lot of caffeine, you drink alcohol. We're still talking about the 4th trimester. Then talking about the 2nd trimester miscarriages, it might be because of long-term health conditions that are chronic health conditions. They increase your chances, your risk of having a miscarriage. You understand? In the 2nd trimester, for example. So when we're talking about, especially this one we're talking about, if they are not treated or well controlled, this can be like diabetes if it is poorly controlled. It can be like severe high blood pressure. It can be lupus erythematosus, lupus. It can be kidney disease. It can be an overactive thyroid gland, hyperthyroidism or hypothyroidism, when the thyroid gland is underactive. And of course, we have something we call antiphospholipid syndrome. This one, then we have infection. And of course, there's some infection which may also increase your risk. Number 1, we have vaginosis, that's a problem with the vagina. We have rubella, that's German measles. We have bacterial infection. We have CMV, cytomegalovirus infection. We have vaginosis, bacterial vaginosis, HIV, chlamydia, gonorrhea, syphilis, malaria. Some medicine increase your risk, like misoprostol. You understand? It's usually used for stomach ulcer, but at the same time, it can cause miscarriage. We have retinoid used for eczema and aching. We have methotrexate. A whole lot of these things can lead to miscarriage. Methotrexate is used for rheumatoid arthritis and is one of the things that can cause it. Then there are some non-steroidal anti-inflammatory drugs like ibuprofen, which are used for pain. To be sure, a medicine is safe in pregnancy, please always check with your doctor, your midwife, your pharmacist before taking it. If you have untreated thyroid disease, untreated thyroid condition, increases the risk of miscarriages. That is just it. Then we have autoimmune condition like lupus. That when autoimmune is when a cell of a particular place begin to attack itself. Just you are my sister and you are attacking me, or you are my husband, you are attacking me. You are attacking. Lupus as well as other autoimmune condition like rheumatoid arthritis can lead to miscarriage. You understand? And the drugs that they use. Then environmental factor, exposure to certain chemicals or hazard can cause miscarriage, like solvent, pesticide, air pollutant. Of course, all of them has been linked with increased risk of miscarriage. Then, of course, if you have a womb structure, or if there's problem with your womb structure, problem and abnormality with your womb can also lead to 2nd trimester miscarriage. At times, the position of your uterus, as I'm your position, your uterus is supposed to be like this. You understand? If the position of the uterus is not in the uterus is not properly placed, it can become a problem. Possible problem with womb structure can be problem with non-cancerous growth in the womb, like fibroid, or an abnormally shaped wound, or the cervix, the mouth of the uterus is weak. In some cases, when it is weak, the pregnancy will not be able to turn. But the neck of the womb, at times, what do? They suture it. You understand? So that, and they give the woman, they call it sacrilege, a bed rest until maybe when the pregnancy is almost time before so we call it weakened or cervical, weakened cervix, or we call it cervical incompetence. A weakened cervix may be caused by previous injury to the area after a surgical procedure, or just any condition of muscle weakness or something which can cause cervix to open early during pregnancy. We have polycystic ovarian syndrome. This is a condition, we call it PCOS. It's a condition where the ovaries are larger than normal. You understand? The ovaries, assuming they are supposed to be, and they are now larger than normal. And of course, it is caused by hormonal changes in the ovaries and all that. So it's one of the things. Then PCOS is also known to be the leading cause of infertility in women, because it prevents the release of egg, which is called ovulation, and there's some evidence to suggest that it may also be linked by an increased risk of miscarriages. You understand? So we have a whole lot of things, food poisoning, or by if you have eaten contaminated food, it can also become a risk factor in when we're talking about miscarriages. So at time when you eat raw food, or you eat fruit that are properly, or cooked egg that is not properly boiled, you might experience food poisoning. Then the third trimester, at the late stage of this pregnancy, a miscarriage is more commonly called stillbirth. We will not say it's miscarriage because it's no longer a blood, but it's developed baby. The same issue that can cause miscarriages in the first 2 trimesters of pregnancy can also be responsible for a pregnancy loss in the 3rd trimester. But understanding the exact cause is often difficult. So what we want to do, this issue might include pregnancy complication, which we can be preterm labor or separation of placenta, placenta abruptio, birth defect, 1 in 10 stillbirths are a result of genetic or structural birth defects. So we are going to be talking, it can be high blood pressure, preeclampsia, which occurs in about 5 to 8% of all pregnancies, while the greatest risk of this condition are the mother. Preeclampsia can cut off the supply of oxygen to this baby, cut oxygen supply, cut nutrient supply to the fetus. You understand? And preeclampsia can also progress to eclampsia, which is a very serious condition. It's very fatal, and if it is not controlled, it can lead to stillbirth, uncontrolled diabetes, infection in the placenta, in the fetus can lead to all these things. So in the next video, we'll be talking, let me talk about the misconception about miscarriage. Some people say an increased risk of miscarriage is not linked to, I want you to know it's not linked to your emotional state during pregnancy. Maybe such as being stressed or depressed, having a shock or fright during pregnancy. No, it is not. Just talk to your doctor. Lifting or straining during pregnancy is not part of it. They just meet. Sitting or standing for long, having sex during period, traveling by air, eating spiced food, recurrent miscarriage. If you had miscarriage, it's natural to worry that you might have another, but it is not always the same. It is not always the same. So you have to, be strong. See your doctor. Most miscarriages are just one-off events, and about 1 in 100 women might experience miscarriage, but it's better to see your doctor before things get out of hand. I remain your friend, Nurse Felicia. See you in the next video. Bye-bye.